Okay. First of all, those who have no idea, as I already said, they don't know about OET. What is OET? It is actually an English test that is conducted for healthcare professionals, and nurses and doctors are on top. So, and apart from these two, the other 10 professionals can also sit for this test, and it is actually recognized by different regulatory healthcare bodies across the world. For example, like UK, Australia, New Zealand, and some other countries as well. In total, there are almost 10 countries, I suppose. I don't know the number exactly, but almost 10 countries who have recognized this test, and after clearing this test, they will allow you to do job there in their country. So this is a test of competency, I suppose. Okay. Some people think, as one of you said, that they have already attended IELTS. Some people think that this test is easier compared to IELTS. Well, that is not true. It is just a rumor because it has actually the same difficulty level compared to any other English test. However, we healthcare professionals have some advantage because actually the topics of discussion in this test are actually in medical language, I would say. They're all related to healthcare. So we find it easy compared to other English tests. If anybody has any question in between, you can ask at that time. I'll just stop and answer your question. If you cannot just speak, you can just ask your question in the chat section as well. Okay, as I said, different countries accept this test. They have recognized it. Australia, United Kingdom, New Zealand, Ireland, Spain, and in USA as well, for especially in Florida, which is one of their state. They have, recognized this test, and some other countries have also, accepted it. Now, in other English tests, they have different criteria. They have kind of what they call it bands, but in OET, we call it grades. We have different grades from A to E. If a person gets score from 450 to 500, they will get grade of A. If it is between 350 to 450, it will be considered B, which is our target, because most of the countries, they want the participants or candidates to have B grade. And in certain circumstances, especially for nurses, some countries accept C+ in writing, especially UK. If a nurse gets C+ in writing and B in the other subtests, they will accept it. But in countries like Australia, New Zealand, they want you to have B+, whether you are a doctor or you're a nurse or physiotherapist or any other professional, you have to have B grade in all subtests. Now we will discuss about subtests as well, that what are those subtests. First of all, let me tell you about which professionals can sit for OET. As I said earlier, nurses and doctors are on top. So nursing, medicine, pharmacy, radiography, physiotherapy, some other professionals can also sit for this test. Now coming to the subtests, as I said earlier, OET actually assess your communication skills from different angles. And what are those different angles? Those angles are listening, reading, writing, and speaking. They want you to be good at listening, reading, writing, and speaking as well. So you have to get B grade in all these subtests in order to get the chance of working in those specific countries where you want to go. Now, I will also tell you about these subtests, that what are their subparts. So let's discuss a little bit about proficient specific tests, and some are different from your proficient, especially listening and reading. I sometimes call them universal tests. By universal tests, I mean they are same for all professions, whether you are a doctor, whether you are a nurse, you are a physiotherapist, you are a radiographist, you will see the same test. You all will see the same test. It will not be different. Anybody has any questions so far?
It's okay.
Okay, if anybody has any question, you can just ask, okay? So as I said, listening and reading are same for all profession. Writing and speaking are specific to your professions. Now, if you are a doctor, in writing task, you will write your letter to maybe whatever the profession of the recipient is, but you will write from medical point of view. If you are a nurse, you will write from nursing point of view. If you are a physiotherapist, you will write from your own specific profession point of view. And speaking will also go the same way. If you're a nurse, you will be given a role play card that will be related to your profession. And if you're a doctor, that role play card will be related to your profession. So I hope it makes sense to you and it is clear for all of you. Okay, somebody has raised hand. Would anybody like to ask any question?
Good evening. Am I audible?
Yes, 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 we can hear you.
Hi, good evening. My question is, as SLAB is replaced by UKLMS, will this affect OET?
Sorry, your voice is not very clear. I could not hear you well. Can you please say it a little clearly, or you may type it in the chat section?
Okay.
Okay, I would like you all to just mute your microphone so that it does not cause any disturbance. Who is this ITIL P36? Okay, thank you. I think everybody has muted their microphone. Thank you so much. Okay, I think it is clear for everyone so far. If anybody has any question, you can ask, and you can also type in the chat section. I will read from there. Okay, coming to subtest listening, which will be your first subtest on the day of your OET. So listening is further divided into three parts: part A, part B, and part C. Okay, let me read the question. Is play replaced by will it affect OET? Well, I don't know about that, but OET is not affected by anything. You have 2 years in it, and it has no effect on your medical tests. So it's all right. I think there's no link between your PLAB and OET. As OET gives you 2 years duration, if you can make in this time to your desired country, it is still effective. So it has no link with it. if anybody else from med exam expert would like to say something about this test or this question, then
Can
we
I
just
interrupt?
proceed with.
It
Yes.
is because you cannot go to PLAB 1 without finishing your OET with a specific grade. Unless you're done with your OET, then you can proceed with your PLAB 1. Otherwise, unfortunately, you can't sit for the exam.
Okay, what you mean is for before you sit for pleb one, you have to pass or clear
Yeah.
your OET.
Yes. You have to finish your
Okay.
English test.
Okay, I'm not sure if that was the question this guy was asking, this Noreen Sheikh. I'm not sure if she was asking this, but her question is, as pleb is replaced by UKMLA, will it affect OET in a specific? So I hope she got the answer.
Yeah.
Okay, okay. Now, as I was discussing about subtest listening, as I said, it has three parts, A, B, and C. Part A has 24 questions, which are divided into 2 extracts. Each extract has 12 questions, and we call these questions blank type of questions or gap-filled question. And after part A, you will have part B, which has 6 questions, and part C has 12 questions, which are divided into 2 extracts. Each extract has 6 questions. I think it will cause a little confusion to you. I will just show it to you how it looks like. Okay. This is your listening part A. I hope you can see my screen. These are called gap-filled question. This is extract 1 from question 1 to 12. In the beginning of this test, you will also be told about the patient's name. In this case, you can look at this name, Roy Miller. You will be told about this, and you will also be told that which professional is talking to the patient, whether it is Roy Miller. Noreen Sheikh has raised hand, so do you want to ask something?
The screen is not visible.
The screen is not
The
visible.
slide ninth slide is only visible.
Your screen is not visible. Oh, wait. Is it visible now?
It's
Okay.
visible, but it's subtest listening. The slide
Okay.
title is subtest listening.
Okay. 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 I'll just do it the other way. Is it visible now?
No, still the same. Yeah. Yeah, now visible.
Okay. Okay. This is extract 1. As I told you that listening part A has 2 extracts, extract 1 and extract 2. Each extract has 12 questions. In total, part A has 24 questions. So this is how it looks like. And as I said, they are called fill in the blanks type of questions or gap-filled questions. So this is how it looks like. And in the beginning of this test, you will also be told about the patient's name. In this case, look at this. The patient's name is Roy Miller. And you will also be told that which professional is talking to the patient, whether it is a doctor, it is a nurse, it is a physiotherapist, or anybody else. You will be told everything. And after that, you will be told that you have 30 seconds to read from question 1 to question 12. So from this part, from question 1, or I should say from blank 1 to blank 12, you'll have 30 seconds to read it all. So in this time, the important thing is that you note some keywords while you listen. For example, uh, in this case, look at this one. Look at blank number 1. It says difficulty walking dash. Now you should, just keep in your mind something like maybe patient is having difficulty walking downstairs, upstairs, or while walking during difficulty walking during what, or there will be certain condition that the patient is having difficulty with. So you should pay very close attention to the speaker, and they will actually speak these words. But keep one thing in mind, that the patient or the professional will not use the exact language or the exact words. They may use synonyms for it. For example, in this case, the patient may say that I always have, some trouble while walking downstairs. So look at this. It says difficulty walking. So the gap will be filled with downstairs. That is how the trick is, and there are other different strategies to it as well. So that will be told to you in the full course as well, because it will consume too much time if I go into the depth of it. So I'm just giving you an overview for it. So in these 30 seconds, you have to just note these keywords, a word before the gap and a word after the gap, and then just to pay attention to the speaker and catch those words and write down them here. This is extract 1. After the extract 1, you will be given another 30 seconds reading extract 2. Look at this from question 13 to 24. You will have 30 seconds again to read from here to here. And keep one thing in mind, if you miss one gap, for example, you miss gap number 13, just don't stay there. Go to the next one, because the speaker will not wait for you. They will just go on. And if you stay here on 13 and they have moved to 14, you should move to 14 as well. Otherwise, you will miss more blanks. Anybody has any question regarding this?
No.
Okay. Now, as I said, that we have no question. Thank you. So part A is clear for everyone. Total of 24 questions divided into 2 extracts. Each extract contains 12 questions. And for reading each extract, you will be given 30 seconds. Now going to part B. Part B actually has 6 questions. And there will be options with it. I'll just show it to you guys. Okay, from here I'll show. This was part A, now going to part B. Okay, this is how part B looks like. You have total of 6 questions. Up to 30, you have 6 questions. And you will be given 3 options to choose from. Okay, before each question, you will be told about this line. Look at this. Look at question number 25. You hear 2 doctors discuss the transfer of care for a patient. You will hear this sentence through your headphone, and then you will be told that now you can read the question, or you'll also be told, please read the question now. So you have to really understand this question, that what they want from you. So once you read this question, then you will hear a conversation between the 2 doctors as you are told in the question. And you should pay a very close attention to them, that what are they discussing about. So you can choose from these options then. The patient's curb 65 score means that he will. So what are the doctors talking about? What do they say about curb 65 score? if the curve 65 score is, what does it mean? Should the patient be transferred to the emergency department, or will the patient receive additional medication and treatment, be treated as an outpatient? So you will hear one of them in the conversation, and sometimes you will hear all of them in the conversation, but you have to focus on which one they have agreed upon, which one they are talking about. Sometimes they may say that the patient's curve 65 score means that the patient should not receive additional treatment. So actually you will hear this one as well. But they said that the patient will not receive additional treatment. So you cannot just, pick up this point. They may say that patient should be transferred to the emergency department. So then you can choose for option A. Maybe they will say that the patient should be treated as an outpatient. Then you should choose option number C. This is how the other questions are like. You hear a speech pathologist talking to the patient who has recently suffered a stroke. So before each question, they will tell you about about what's going to happen. Like you will always hear this line, and then you will read the question by yourself. So the key point here is to read the question well and understand it. On the test day, you will have some extra pressure on you. You will be a little nervous. So you have to keep yourself calm and understand the questions really well. So if you cannot understand the question, it will be really, really difficult for you to, choose the correct option. Because in the conversation, you will almost hear all of these options, but it doesn't mean that all correct. To choose the correct one, you have to understand the question very well. What does she want to know about her husband's condition? So she might have asked a question to the professional, to the pathologist. So you should really pay attention to that what has she asked? Does she want to know about the time of recovery, whether communication issues will be improved, what she can do to speed the healing process? So this is how all these 6 questions are. Is it clear to you all so far, or do you have any query? Okay.
No queries.
Okay, thank you. Now, part A and part B both are clear for all of you. Now coming to part C. Just like part A, part C has 2 extracts as well. And in total, it has 12 questions, which are divided into 2 extracts, and each extract has 6 questions. And this part of subtest listening is considered a little difficult compared to the previous 2 parts, because you will be doing 3 tasks at the same time. For example, you will also read your question. You will listen to the speaker as well. You will be listening to a dialogue or a monologue. And at the same time, you will also choose answers. Let me show it to you. Okay, now coming to part C. Okay, this is part C. Part C, as I said, it has 2 extracts, and each extract has 6 questions. So this has 6 questions, and this is extract 2 of part C. Now let's focus on extract 1. So you're given information here about extract 1 from question 31 to 36. You will be told that you hear an interview with Dr. Matthew, who is talking about meningitis caused by this bacteria. So before each question, you will not be given time to, read each question and then listen to the conversation like part B. Part B was quite easy and different. You will be given time before each question in part B, but in part C, you will hear a continuous dialogue or monologue. Maybe there will be a doctor or a nurse or any other professional talking about a research or talking about their experience, or maybe there will be two professionals talking about some research or their their experience. So you will be given 90 seconds in the beginning to read from question 31 to 36. So what you need to do for this part is to understand each question very well, because sometimes you will not be even able to know where the speaker has gone to. Sometimes you will be, looking for your answer here, and the speaker might have moved to question 32. So in order to catch all those words, you have to know certain words in each question. Like for example, in question 31, it says about the onset of meningitis. So maybe they will mention about the word onset in their conversation. So you should know that they are at this question. At that moment, they are here. So that will help you to know where the speakers are. And look at question number 32 about college students. So before they start, what you need to do in those 90 seconds to underline these keywords, like in this question, college students, or in question number 31, underline the word onset of meningitis. And look at question number 33 about treatment. Seek treatment. You need to underline this word as well, because when they talk about treatment, you should know that they are at this question. So you should move straight away to this question. Look at question number 34. Treating before receiving the spinal fluid result. Underline the word spinal fluid results. So when they mention this word, you should know that they are at this point, they are at this question. That will help you, because you will not get any time to answer a question. You will hear, you will read your question, and you will answer your question. You will do three things at the same time. You will do three tasks at the same time, and that is what makes it difficult. That is why people say that part C of listening is very difficult. It's because of this point that you will not get separate time for each question. Look at all these questions. After finishing this extract, you will move to extract 2, and again you will be given 90 seconds to read from question 37 to question number 42. And again, what you need to do is underline the keywords in each question, and maybe underline the keywords in the options as well if you want to. And once you find the correct option, what you need to do is just encircle here, just fill this circle. Is it clear for everyone up to this point, or anybody would like to ask any question? If you have any question, please proceed. Okay, I hope subtest listening is clear for everyone.
Yeah.
Okay. Okay, coming to subtest reading, just like part A, sorry, just like listening, we have three parts of reading as well. And in listening, you are not bound to time, but in reading, you'll have to work according to the timing, according to the time you are given. That is what makes it difficult for most of the candidates. Like for all these three parts, you will be given 1 hour of time. For part A, you will have 20 questions and you will be given 4 small paragraphs or texts. And paragraph, you may say text. So it needs good time management strategy because you will have only 15 minutes to answer those 20 questions from those 4 texts. So you will read those texts as well, and then you will have to answer those questions as well. So it really needs a good strategy for time management. Because if an average person reads, 4 paragraphs, it will take him or her at least 5 to 6 minutes, and then they have to come and answer all those 20 questions. So it makes it really difficult to cover up all these 20 questions. For that, we will tell you some strategies how you can read all those 4 texts in less than a minute or maybe in a minute, and then you can just go to your questions and answer them all. I'll show it to you guys how this works or how it is reading section. Okay. Can you see my screen now? Is my screen visible now? I hope it is visible to everyone. Okay. As I said about 4 texts in part A, look at this. I'll just go to this. This is what I was referring to. I said that you will have 4 small paragraphs or text. This is text A. This is text B. And this is your text C and text D. We'll also have maybe a graph or something like that. Okay, I'll just move to another test that I think will be clear for you. That was a little confusing. We will talk about all this subparts of reading. I'll not just move to the other slides. Okay. Now you guys will have, you know, only 15 minutes to read from text A to text D. Not 15 minutes just for reading, but 15 minutes for reading them all and answering all the 20 questions at the end. So what do you think, how much time will it take you to read from here to here? I suppose it will take at least 2 minutes to read from this area to almost till the end for an average person and to understand it. So that is why I say a person would need a very good strategy to manage their time well in order to read them all and then answer the question. This is your text A. This is your text B. You may have some diagrams or, you know, shapes like this. You have to pay attention to them as well, because you might be, you might face a question that will come from this area. I'll show you questions as well at the end. This is text C, or what we call paragraph or small paragraphs. This is quite lengthy. Just 1 minute or 2 minutes are not enough for to read them all and understand them. This is your text D. Now, you'll have 6 or 7 questions that will just say that from which text a certain information comes from. Like, look at this. In which text can you find information about treating patients with anemia? So what you need to do is just to write here A, B, C, or D. It depends from which text this information comes. So you should go to the text and read it there and find out where does those information come from. Let's just go to the text and see where does this information come from. Treating patient with anemia. So it talks about treatment. Look at this. The treatment of anemia depends heavily on the type of anemia that patient is experiencing. So I can guess that it comes from text D. Let's have a look at text C as well. There are many different causes. These are causes, classification. So in that area, I'll just write text D. I hope it is clear for everyone. What I'll write here is just I'll write D. This information comes from text D. Now look at this, the symptoms of hypoxia. Where does this statement come from? Or in which text they have discussed about the symptoms of hypoxia? So it depends. You should just go to the texts and find out where does this information come from, and then write here whether it comes from text A, text B, text C, or text D. This is how these questions work. Now, coming to the next questions, out of these 20 questions, you will face 6 or 7 questions in which you will just write A, B, C, or D. Now, what should vegan patients with vitamin deficiency anemia be encouraged to add to their diet? So we call them one word answer questions. You can just write here one word, and you should go to the text and find out what they can take instead of for example, if they cannot eat meat, what they should take instead in order to have a good supplements in their diet. What should vegan patient with vitamin deficiency anemia be encouraged to add to their diet? What they need to add to their diet, we can find it in the texts. I hope it is clear for everyone. Anybody has any questions so far? If anybody would like to ask a question, they can just unmute and ask me, or they can write it in the chat section as well. Okay, this is how part A is like, and after this you'll also face questions like these, these are called short sentence answer question. Maybe in some parts you will have to write short sentences. Make sure you will not, if you make a small mistake regarding spelling, that will be considered wrong. You should, copy the exact word from there and write it here, especially in reading part. In listening, if you make a spelling error in part A, they will not consider it wrong. But in reading, if you make a small mistake, maybe if you write E instead of A, it will be considered wrong because you will just do copy paste, and you don't have to write anything from your own mind. You have to just copy from the text and write it here in the gaps. Now coming to reading part B. In reading part B, you have total of total of 6 questions, and for each question you will be given a small text or small paragraph. What you need to do is uh, read the question, then go to the text and find the answer by yourself there, and then come to the options and read the options and select which one is correct. This is a good strategy. If you read the question and go straight to the text and find the answer by yourself. If you just read the question and then read the option and then go to the text, it will cause confusion to you. So I would suggest you to go straight to the text after reading the question. And I would also like to tell you that we have different strategies for reading part A, part B, and part C. There are different strategies, and it doesn't mean that each strategy will or one strategy will work for everyone. No, there are different people and different strategy work for different people. If one strategy work for me, it doesn't mean that it will work for you as well. Maybe there will be another strategy that will be compatible for you. So we have different professionals, and they know what their students need and what they are good at. So they will, according to your ability and according to your understanding, they will tell you about certain strategies that you need to follow. So this is how part B looks like, and this is how it is. You will be given a text like this, and you'll be given a question, and you'll have these options as well. So you read this question, then go to the text and understand the text well, then come to the option and choose one of them. Now, for question number 2, you will be given another text, and you have a question here. The guidelines inform us that physical restraints, and you should go to this text and find out what does the guideline tell us about physical restraints. Then you can read these options and choose one of them, which one you think is correct. This is how this part B looks. In part B, you have 6 questions, and you will be given 6 text for all these questions. So it means that each question will have a text for it that you will read. Is part B and part A of subtest reading clear for everyone? Or would anybody like to ask any question if there is any confusion or query? Okay. Sajjad, okay. He said that he has no question. Now let's go to reading part C. This was question number 6 of part B. They have actually mentioned different questions. I'll just go through all these to move to part C, show you how it looks like. Okay, as I said that part C has, okay, I'll just move to presentation to let you know about it. Okay, subtest reading, it has, as I said, 3 parts, A, B, C. You have total of 1 hour. Part A has 20 questions, as I said, and you will be given 4 small text that you have to answer from. It needs good time management. You'll have 15 minutes to answer them all. Okay, as I discussed about part B, part B and part C collectively have 45 minutes. You'll have 45 minutes to answer all those questions in section part B and part C. I showed to you that part B has 6 questions and how they look like, what the texts look like. You'll be given 3 options that you can choose correct one from. Now coming to part C has 2 extracts, each containing 8 questions. So total of 16 questions. You will be given 2 lengthy texts and they will have approximately 800 words. And with each question, you will be given 4 options from which you will choose the correct one. I'll show you how it looks like. This is how part C looks like. You are given, this is text 1. As I said, you will be given 2 texts, each containing approximately 800 words, and you will be given 8 questions in each extract, total of 16 questions. Okay, look at these texts. These are very lengthy, and that is what makes, it difficult. Reading part C is really difficult. So you need a very good, strategy for answering these questions. Okay, look at these questions. So I would suggest you in the beginning, you don't have to go through until the end. You don't have to do that. And straight away, question number first. It says in the first paragraph, the writer suggests loss of voice is difficult for patient because it is. Then you are given these 4 options. What I would suggest you not to read the text in the beginning. You should come to the question straight away, and it says in the first paragraph. So what you need to do is go straight to the first paragraph. What does the writer say there? So you will come here. This is your first paragraph. Look at it. This is the first paragraph. You should read it and understand really well and find the answer to that question. And then go to it, go to the question and mark the correct answer. So it is not that easy. For that you need to have proper understanding of the paragraph and also proper understanding of the text as well, of the questions as well. So for that there are different strategies as well. In reading we have almost 4 types of questions. One is called lexical questions, referral questions, normal questions, and in some questions you will be asked, there will be kind of statement in which you have to just understand the idea or the the main point of the paragraph. You will not find answer to such questions, the whole idea. So this is number second. Why does the writer believe it is important that speech replacement devices be operated by a variety of methods. So it doesn't mention anything about paragraph. So the first question was regarding first paragraph. So this is going to be regarding the second paragraph. So what you need to do is go straight to second paragraph and find answer to this question. So in the beginning, you don't have to read all those words to, you don't have to waste your time. You have only 45 minutes to answer questions in part B and part C. Look at this in the third paragraph, we learn that they have given the name of a person developed the POSM due to. So what you need to do is go straight to the paragraph number 3 and find answer to this question. This is how all these questions are and how they look like. What I said about lexical question, look at this. If you face questions like this, these are called lexical questions. The writer uses the phrase raising the bar to underline the. So these are lexical questions. If you are given more than one word in bold form or underlined in the question, they are called lexical questions. If you have one word that is underlined or in bold form, that is called referral questions. And there is a strategy that is used for it is, you know what you need to do is you need to go to the paragraph and find the word. Maybe in the previous question we said that it was talking about paragraph number 3, so this question might be in paragraph number 4. Let's see it. Raising the bar, it will be underlined or made bold in the paragraph. Okay, I don't know if they have not made it bold in that case, but look at this one. This is also a lexical question. So in order to understand the meaning of these words, you don't have to have, knowledge of the meaning of those words. Yeah, it is necessary, but you cannot just rely on the meaning of those words. You have to understand these words according to the context. So to understand it, you don't have to read from the beginning till the end, because it will just consume too much of your time. What you need to do is to read a sentence before it and a sentence after it, so you will be able to understand it. Look at it from here. Although voice donation does not require the contributor, from here you can read till here. This is sentence 1, and from here up to here you can read up to here, so you will understand the meaning of these words according to the context. This is how reading part C is. This was extract 1. Now let's go to extract 2. This is the referral type of question. Look at this. What does the word it refers to in the final paragraph? The final paragraph means in the last paragraph. You should go to it and do the same, strategy for it, reading one sentence before it and one sentence after it. Then you will understand the meaning of it according to the context that what it refers to. Look at this question number 7. In the fifth paragraph, the word users refer to. So you need to find, again, use the same strategy for it as well. Anybody has any questions so far? Okay. Now we will, okay, this, look at this, this is text 2. I'll just go to part B. Look at this. You have oh, oh, a group of paragraphs containing almost 800 words, and then you will be given questions at the end for them, and you have to just go to the questions and find out. Look at this. In the first paragraph, the writer highlights that opiate addiction in the US. So what you need to do is go to the first paragraph and find answer to this question. This is how you should do in all of the questions. In the second paragraph, the writer outlines this question in order to emphasize that. So you should go to the second paragraph and find the answer to the question. This is how you will do it in all the other questions as well. I hope reading part A, B, and C is clear for everyone now. If anybody has any difficulty, query, or question, please proceed and ask me. I would like to answer your questions. Okay, this was all about reading part A, listening and reading. Now going to writing. Okay, in writing we have actually three types of letters. One is a referral letter. Most of the time you will be asked to write a referral letter, discharge letter, and transfer letter. And each letter has a different format. You know, if you are given a discharge letter, you will use a specific format for it. You cannot write it the way you would write a referral letter, or you cannot write it the way you would write a transfer letter. So, and as I said earlier, that writing and reading are profession specific. Sorry, writing and speaking are profession specific. If you are a nurse, you will be asked to write according to, you know, or from nursing point of view. If you are a doctor, you will be asked to write from medical point of view or from, you know, doctor's point of view. If you are a physiotherapist, you will write from that point of view. Now I'll show you, for those who are new, I'll show for them that how it looks like, how the writing tasks look like. Okay, look at this. You will be given these case notes. You have to read from here. You have to read all these information regarding the patient, patient's name, date of birth, address, social background, then about the medical history, family medical history, lifestyle, medication. You are given all these information, and at the end you are given a writing task. So before you read all the information above, you need to straight away go to the writing task and find out what you are asked for, whether you are asked for discharge letter, referral letter, or transfer letter. So look at this part, write a letter of referral to the emergency department. So you should first know about it and then follow the format of a referral letter. There are different formats for them. As I said earlier, that you cannot use one format for all of them. So what are those formats? They will be told, and you will be told about them in the full course, and you will be guided how you need to write. How is the letter written like? Look at this. These are from official OET website. In the beginning, you'll write about the address to whom you are going to write. If the name of the person is mentioned, you'll write it up here. Then about the address, date should be written in this format. Then greeting, you're writing to a doctor, nurse, physiotherapist, or to whoever you're writing. You should write it here. Dear doctor, dear nurse. Or if a name is mentioned to whom you're writing, then you should write dear and then write their name. And then reference, write about the patient's. You should write full name of the patient here. You should not just write last name or first name. You should write full name and then date of birth. Then you should write like this. So this is a very standard letter. uh, you know it is a letter of 500 marks, I should say. So in order to be guided, everything will be told to you in the full course, how you need to write these letters and how you need to interpret these case notes. Because in the letter you don't have to mention irrelevant information, and you don't have to miss important information. If you do so, you will lose marks, you will lose your score. So for that, proper guidance is really needed, and that's what you will be told. You'll be guided step by step, because this is not something a person can learn just by sitting and writing over and over. You always need proper guidance for it. Is it clear to everyone so far, or anybody has any question? And again, you will have 45 minutes for writing. In the first 5 minutes, you will not be allowed to write or underline anything. You will just be allowed to read the case notes. And after those 5 minutes, then you will be asked that now you can write, or if you want to underline, you can do that. So for writing, you have 40 minutes, 5 minutes for reading, 40 minutes for writing, total 45 minutes. Anybody would like to say something? If you guys have any questions, please ask. I'm here to answer them. Okay, as I showed to you that you will be given case notes about the patient, and a task will be given to you that what type of letter to write. And you should keep in mind that you're allowed to write 180 to 200 words, not more than that. If you write up to 210, that's fine. If you write it from 170 to 175, that's also fine. But it should not be too short, or it should not be too long. If you write it too long, it means that you have shown some irrelevant information, so your score will be reduced. And if you write it too short, it means you have missed some important information, so again your score will be reduced as well. So tell me if anybody has any question. Then we move to the next part, to the role play part, to the speaking task. Okay. Coming to the speaking part, you will have total of 2 role plays, and for those role plays, you have 20 minutes time. So when you go for your test, when you enter the room for speaking, I think there was so much disturbance. Okay. You have 2 role plays and you have total of 20 minutes time. When you enter the room for speaking, the first 3 minutes are for warm-up questions. And just keep in mind, these warm-up questions are not included in the scoring criteria, or you will not be judged for these questions. These questions are just for, you know, to understand the accent of your interlocutor, and the interlocutor understand your accent. Okay, can you please mute yourself because there's too much noise in the background? Okay, for speaking part, as I said, you'll have 20 minutes and you have 2 role plays. In the first 3 minutes, you will be asked warm-up questions. And these warm-up questions, as I said, are not included in the scoring criteria, and they may be related to your profession. If you're a doctor, you might be asked like, why, why do you, or why did you choose this profession? Why did you decide to become a doctor? You can answer to this question in any way because it is not included in the scoring criteria. And I suggest all of you to speak as much as possible in these 3 minutes because it will, you will gain your confidence in these 3 minutes. Obviously, you will be very nervous in the beginning, and everybody is nervous whenever they go for the test. But if you speak as much as possible in these 3 minutes, you will reduce your stress and you will be less anxious. So I suggest you to speak as much as you can. And the next 3 minutes, you will be asked, you will be told about your role play card. You will be said that now you have 3 minutes to read this role play card and prepare yourself for the role play. And after these 3 minutes, once you go through the role play card, then you will be told that now you have 5 minutes to do the role play. So in those 5 minutes, you have to finish all those tasks. I'll show it to you that how the role play card looks like. Okay, I'll show it to you here. Okay, I hope you can see my screen now. Look at this. This is how your role play card would look like. This is for the interlocutor. This is the patient's part. You will not be able to see this. You will be given this one. Look at this. This card. This is nurse setting. If you are a doctor, would they would write medicine or doctor setting or whatever. So you will only see your portion. This is your role play card. In the beginning, after the warm-up questions, you will be given 3 minutes to read all these parts, all these bullet parts, and the details of the patient. So the important thing is, first of all, you should look at the setting, that where are you working? Is it a hospital? Is it a clinic? Or is it a community health center? Or wherever you work? Because obviously you need to understand it. In the beginning, when you introduce yourself, you will mention your setting as well. For example, if it is a hospital, you will say something like, if you're a nurse, you will say something like that I'm one of the registered nurse here at this hospital. If it's a clinic, you will say I'm one of the registered nurse here at this community health clinic. So you will use the setting in your introduction. So first of all, you'll have to look at this and understand. Then you will look at the details of the patient. Look at these are the details. You have been nursing an elderly patient who had hip replacement. You will read all these and understand, and then look at your tasks. These are the tasks. This is what you will ask the patient or tell the patient. Make sure that the patient has support from family or friends. This is what you will do, ask the patient, and you have total of 5 minutes to do all these things. So in the beginning, you will introduce yourself to the patient, then ask the patient's name, and then coming to your tasks. And after finishing them, you will do closing, wishing patient best of luck, or telling the patient that you wish them a speedy recovery. And if they have any question, they can ask you, or whatever. You will be guided properly in the full course at how you need to do these role plays. So this was just for those who are totally new to OET, and that is what we wanted them to know. If anybody has any question, please proceed with it and ask me. I will be more than glad to clear your queries and answer your questions. So in speaking, two skills are checked, or I should say assessed: clinical skills and linguistic skills. Linguistic skills have further 4 parts, and they are scored on a scale of 0 to 6. And clinical skills have further 5 parts, and they are scored on a scale of 0 to 3. And what are those subparts? What are those subparts? I said that clinical skills have 5 parts and linguistic skills have 4 parts. What are they? You will be told about them in the full course and guided properly about them in detail. I will try to answer this question. You said that if somebody has good English, but still they are not confident, or their contents are not good, what will they do? Is that what you mean? Please tell me if I, summarized your question correctly.
Oh, yeah, I was speaking. I forgot to unmute my mic. I'm sorry. So I was telling you that if someone is confident and they are fluent,
Okay.
but their vocab in medical field, for example, is not really to the, how can I say, to the level, up to the level. So will
Okay.
this really affect their speaking skills?
Okay, that's a really good question. Let me answer this question. If your English is good, your communication skills are good, and you can speak fluently, and you have those clinical skills as well, but you don't have uh, in-depth knowledge of medical terminologies, that's all right. It is not your medical exam, it's your English exam. If you say something that is medically wrong, that's all right. It will not, reduce your score. Even if you say something that is totally wrong in medical, that's all right, because they are not checking you for your medical knowledge. They are checking you for your English skills, your communication skills, how you pronounce, how you satisfy the patient, and how you understand the patient. These are all the skills, And if you want to know all the skills that are required, as I said, clinical and linguistic skills, then we have, sub parts in them. I would suggest you to join our full course. You will be guided properly step by step. But again, no, this is not your medical test. Even if you say something like eating food will cause you cancer, that's all right. This is not your medical knowledge. I hope I have
Got your.
clearly.
Yeah, it is. Thank you.